Today we'll discuss the thenar, hypothenar muscles. See here, the hand muscles, there is intrinsic muscles, 20 muscles are there. Thenar 4 muscles, hypothenar 4 muscles, 4 lumbricals, 4 palmar interosseous, 4 dorsal interosseous are there. These are the 20 small size muscles, intrinsic muscles of the hand. I can show now. These are the thenar muscles. This side, where is the thumb side? These are the thenar muscles, 4 muscles. This is the flexor pollicis brevis. Flexor pollicis brevis. This is the abductor pollicis brevis. After reflecting this abductor pollicis brevis below, opponent's pollicis is there. Opponent's pollicis. Next, this is the adductor pollicis. This is the adductor pollicis. There is a 2 heads are there. Oblique head and transverse head is there. This is the oblique head. This is the transverse head is there. These are the 4 muscles present in the thenar region. Adductor pollicis, flexor pollicis brevis, abductor pollicis brevis, opponent's pollicis. These are the 4 muscles, thenar muscles. These 4 muscles now supply is, this is the lateral side. Here we can identify the median now going to supplies. So these 3 muscles going to supplied by the median now, whereas the adductor pollicis is going to supplied by the D branch of the ulnar nerve. D branch of the ulnar nerve. Next, here 4 muscles are there. Hypothenar muscles. Hypothenar. So while removing the skin superficial only, we are lost that is the palmaris brevis is there. After removing this, we can identify the 3 muscles. This is the flexor digiti minimi. Flexor digiti minimi. Abductor digiti minimi. Below we can identify the opponent's digiti minimi. Opponent's digiti minimi, abductor digiti minimi, flexor digiti minimi. These are the 4 muscles now supplied by the ulnar nerve. Superficial branch going to supplied by the palmaris brevis. Remaining these 3 muscles, hypothenar muscles, supplied by the D branch of the ulnar nerve. So hypothenar 4 muscles, thenar 4 muscles, 8 muscles. Next, lumbricals, 4 lumbricals are there. These are takes origin from the flexor digitorum profundus. See here, this is a flexor digitorum profundus tendon. Flexor digitorum profundus tendon. See here, this is the unipennate muscle, first lumbrical. This is the first lumbrical. This is the second lumbrical. See here, this is the second lumbrical. Next, third and fourth is the bipennate muscle. See here, this is the third lumbrical bipennate muscle. This is the fourth lumbrical also bipennate muscle. See here. See, this is the fourth lumbrical. This is the third lumbrical. These 2 are the bipennate muscles. This is the second lumbrical, unipennate. This is the first lumbrical, unipennate. These 2 unipennate muscles now supplied by the median nerve, whereas the third and fourth bipennate muscles, this is now supplied by D branch of the ulnar nerve. So these are the 4 lumbricals. This takes origin from the flexor digitorum profundus tendons. See how it is, flexor digitorum profundus tendon. This is the flexor digitorum. Superficial is how it splits like a 2. See, 2 splits going to insert it at the base of the middle phalanx, where the deep goes to the base of the distal phalanx. This is the distal phalanx. See how it is divides. Next, after removing all this, we can identify the inside 4 palmar interosseous, dorsal side 4 dorsal interosseous are there. See here, after removing this dorsal expansion, distal expansion, see here we can identify the interosseous muscles are there. These are the dorsal interosseous muscles. 4 muscles are there. So palmar interosseous 4, dorsal interosseous 4. This 8 4 interosseous now supplied by D branch of the ulnar nerve. So out of 20 intrinsic muscles of the hand, 13 muscles supplied by the D branch of the ulnar nerve, remaining 8 going to supplied by the median nerve. Next, after this, we can also finding here superficial palmar arch. See here, this is a continuation of the ulnar artery. This crossing above the flexor retinaculum like this. Flexor retinaculum above, this artery is going and now also going. See these two structures. This is the ulnar nerve. This is the ulnar artery. These two are crossing above the flexor retinaculum. See, this ulnar artery continuation make a arch in the palmar region. This is called the superficial palmar arch, continuation by ulnar artery. It give after making here arch, it give a branch, distal branches. See here also, these are the distal branches. Next, continuation and anastomosing with the D branch of the radial artery, that make a D palmar arch. D palmar arch formed by the continuation of the radial artery, whereas the superficial palmar arch formed by the ulnar artery. This may ask in the viva questions. Next, not only this, in the hand region, this is the median nerve. See, median nerve how it is going to supply. These are the Thenar branches. These are the Thenar branches, 3 branches, Thenar branches and distal branches. See how it is. So it's going to supply up to here in the ring finger. Remaining these 2 fingers supplied by the ulnar nerve up to this ring finger lateral side. It is going to supply to this. This is supplied by the median nerve. This is the median nerve. It is crossing below the retinaculum. It is present in the carpal tunnel. See here. This is a carpal tunnel. This is a tunnel. How it is. So this is present here. These are all structures. Flexor digitorum superficialis, flexor digitorum profundus. All tendons crossing through this carpal tunnel. See. Thank you.